morning to one and all. I'm very happy to be here to present my paper on the efficacy of a biodegradable film from pullulan on wound healing in rats. We all know that wound healing is a fundamental response to tissue injury, the end product of which is a dense connective tissue. Wound healing occurs in three interlinked, well-orchestrated phases called the inflammatory, the proliferative, and the maturation phase. We have taken pullulan, a polysaccharide polymer produced by a fungus called Areobasidium pullulans. Pullulan is a homopolysaccharide. It is found in three trioses, maltotrioses, linked with the glucose molecule in each maltotriose is linked by alpha 1,4. And each maltotriose is linked with the next maltotriose by alpha 1,6 linkage, and this pullulan is alpha glycan. This is used in food industry and pharma industry also. And this is our experimental protocol. We have prepared the pullulan film, and then we created wounds, both excision and incision wounds. And then we placed the pullulan films on the wounds. And we take the granulation tissues formed on different days and estimated all the biochemical and biophysical parameters, and histological sections also we did. The biophysical parameters, what we have done is total collagen, hexosamine, and uronic acid. Biophysical parameters studied are tensile strength, shrinkage temperature, rate of contraction, and the number of days taken for the wounds to heal completely. Here I show the preparation of a pullulan film. We take 10% pullulan, dissolve it in distilled water, stirred it for 3 hours, and then we poured it in troughs. We got 2 mm thick films after 4 to 7 days of air drying. Then the film, we cut the films into 2.5 centimeters square, and then we use the films for experiments. This is how we have done the excision wound. We gave the thiopentane sodium as anesthetic agent, and then with the back of the rats was shaved, and 2 centimeter into 2 centimeter square rats skin, the excision wounds were formed, and the control rats were treated with PBS. The experimental rats were treated with the pullulan films. The incision wound was made similarly, like after anesthesia, the back of the rats were shaved, and a 3 centimeter incision was made on both the rats, control and experimental. The control rats were treated with PBS, and the treated rats, we placed the films. The biochemical parameters, what we have studied is collagen, uronic acid, and hexosamine. Here you could see a 2-fold increase in collagen content in the treated on both day 4 and day 8 comparatively. And the hexosamine is also very much increased. Uronic acid also increased in the treated group when compared to the control group. This is a photomicrographical representation of the contraction rate. You could see at 11 days in the control, the wounds have not healed fully, but in the treated wounds, it is completely healed by 11 days. This is a representation of the data representation of the rate of contraction. Almost 100% healing by 11 days, to only 71% of healing in the control rats. The period of epithelialization is the number of days taken for the wounds to heal completely, and it takes 11 days as I mentioned, whereas it takes 11 to 12 days in the experimental, whereas in control it takes 21 to 22 days. This study we have done for the rejoining of incision without any sutures. We made the incision 3 centimeters, and we placed the pullulan film every day. And we could see the rejoining started in 3 days itself in the control experimental rats when compared to the control. And on day 6, you could not see the place where we made the incision also. On 8th day, it is almost like no wound is there. But when compared to the control, it is on day 8 also the wound is not completely closed. So we have done the tensile strength for the incision wounds, and you could see there is a drastic increase in the tensile strength of the wound when compared to the control. Shrinkage temperature is also done for both in the granulation tissues of 4th day and 8th day. And you could see there is a significant increase in the tensile shrinkage temperature of the granulation tissues in the treated rats when compared to the control. And this slide shows the histology of the 4th day wounds. You could see the cellular infiltration is very high in the treated tissues when compared to the control. And in 8th day, the epithelialization or keratinization is not started completely, but in here it is, and the collagen is also very high when compared to the control. And in the 11th day, the epithelialization is almost complete, and the wound is almost acellular when compared to the control where the cells are there and the epithelialization is not totally complete. Thus, we can conclude that this pullulan helps wound healing in all possible ways, but the mechanism by which this pullulan helps, we have to study further. This is a preliminary study, just we have started. Thank you.
Consent? Yes.
Diabetic wounds or
No,
burns,
sir,
for example? Because it could be interesting to see.
Yeah, we are planning to do further studies will be on diabetic and the mechanism of healing.
I think I'm sorry, I missed that your background part. Pullulan is a plant or?
Is a polysaccharide secreted by a fungus, sir.
Oh, it is secreted by a fungus. Okay.
Ariobasidium pullulans.
I see.
Okay.
So when you do that, when you did that wound healing experiments, you opened 2 centimeters by 2 centimeters.
Excision wound. Okay.
Yeah. So how do you maintain the contamination in the control mice? Because that was not closed. For 11 days.
We wipe the wounds with ethanol, that is also.
Every day?
Every day.
Okay. Any more questions? Okay. If that is the case, I will take an opportunity to hand over the certificate of recognition to Dr. Suguna, and I will thank you very much.